Stivax is an effective treatment option for pain conditions, both acute and chronic. Conditions such as peripheral arterial disease can also be positively affected. Stivax is a battery-powered neurostimulation device that provides multiple phase variable output settings. Several output adjustments and array refinements can be made during each 20-day treatment cycle. 3 devices are used during a 60-day treatment protocol. FDA-approved Stivax is highly functional as a minimally invasive non-narcotic pain treatment for back, joint, arthritic, migraine, and various neuropathies. Activation of endogenous opioids or encephalins in the substantia gelatinosa of spinal gray matter results in inhibition of pain signals to the brain. The modulations in the brainstem caused by intermittent continuous stimulation of the vagus nerve in the triangular fossa can also create improved microcirculation in the extremities, resulting in positive effects in treating peripheral artery disease. The outcome is a higher quality of life for your patient population. Stivax provides a continuous flow of intermittent, low-frequency electrical pulses to specific peripheral nerves, which are adjustable by the treating physician according to diagnosis and patient comfort. For treatment of conditions such as peripheral arterial disease, stimulation of the afferent branch of the vagus nerve, which connects directly to the brainstem, is used to achieve improved microcirculation in the extremities via arterioles. Ongoing clinical observations repeatedly show an improvement of initial symptoms. The Stivax package contains the adjustable neurostimulator and 3 titanium-tipped arrays used in periodic rotation as output parameters are modified in each 20-day treatment period. The device will operate for 360 hours, or about 14 days. Therefore, the package also contains 3 Swiss-made titanium needle arrays, adhesive back clips for securing the stimulator to the patient, several needle array length estimators for approximating optimal shoulder placement, multiple medical device identification stickers for patient records and reimbursement purposes, fixation plasters and alcohol swabs, multiple-use magnetic pin to change the intensity levels on the device, 1 LED illuminator and light bender starter kit, and clinical-grade disposable bags. To prepare the Stivax device for use, open the package and put aside the following items: the stimulator, 1 needle array, 1 clip, 1 length estimator, 3 fixation plasters, 1 alcohol swab, 1 device identification sticker. Don't forget to attach this to the patient's medical record, the LED illuminator, the magnetic pin, and disposable bags. Do not connect the stimulator to the needle array at this time. Once the doctor has completed the procedure, return the magnetic pin to the box. Other items which may be useful to install the device are as follows: Tegaderm or similar medical dressing with breathable properties that can be used to add stability to the device while the patient is undergoing treatment, sterile tweezers, thin point permanent marker, sterile gloves, although the Stivax installation procedure may be completed with or without gloves, as it is not a sterile procedure. The Stivax installation procedure begins with the following standard hand washing protocols for clinical environments. Prepare the patient for installation of the Stivax device by cleaning the upper area of the patient's ear with the alcohol swab. Be sure to clean both sides of the ear, in the puncture area and behind the ear where the fixation plasters will adhere. Also clean a large area of the patient's shoulder on the same side as the ear that's being prepped for device installation. Using the LED illuminator, direct light to the back of the ear to identify the location of the nerve endings. Use the thin point marker to mark the insertion point in the afferent nerve net, located in the triangular fossa, slightly darker and easily seen when illuminated, which leads to C2 and C3 of the solitary nucleus in the brainstem. Optimal placement is normally inside the triangular point closest to the superior crus. Using the length estimator, approximate the distance of the needle array to the area of the shoulder where the stimulator device will be secured. Mark the location. Affix the stimulator clip plaster to the shoulder. Remove the needle array from its packaging and connect to the Stivax stimulator. Connecting the stimulator device to the array permanently activates the battery for the 360-hour cycle. Using the magnetic pin, adjust the intensity level to the desired setting. To reduce the intensity by one level, tap the pin near the blue circle on the device. The LED will blink once to confirm a change in status. To increase the level, slide the pin from the blue circle out and in again without losing contact with the surface. The LED will blink twice to confirm a change in status. If level is unknown, increase the intensity level until the LED blinks 4 times. This indicates the device has reached level 16, its highest setting. Likewise, if your office has a Stivax current multimeter, you can also use that to determine the device's current stimulation setting. The Stivax device allows for setting the intensity in the range of step 0 to 16. The default factory setting is set to step 6. Secure the stimulator into the clip to prevent the weight of the device from interfering with the installation of the needle array. You'll hear a click when the device has been secured in the clip. Using the sterile tweezers, position the titanium needles on the array over the marked area on the ear and gently push them into the ear tissue. Once installed, take care to secure the array in 2 directions using the fixation plasters. Take care to also secure the array lead with another fixation plaster just above the shoulder clip. Adding Tagaderm to the ear and shoulder sites will add strength and help to prevent the device from becoming dislodged before the patient's next follow-up visit. Don't forget to adhere the device identification sticker to your patient records. An appropriate observation period should be ordered following device installation and prior to patient discharge. Follow-up appointments for device calibration should be scheduled at day 3 to 5 and day 10 or 11. Removal will be on day 14 or 15, with a new cycle beginning on day 22, which allows for the device's sustained effect. Final protocol can only be determined by the treating physician. Your representative and billing and compliance advisor may offer valuable assistance. During each follow-up visit, a new needle array will be used with the Stivax device. Take care to alternate placement location between each procedure to prevent irritation of the insertion site. Each follow-up appointment should be utilized for assessment of efficacy and adjustments of continuing treatment. When treatment has concluded, remove the needle array, taking care to avoid contact with the needles. Disposal of the array and the appliance should be done in accordance with local regulations. If the patient is not returning, provide them one of the clinical grade bags to dispose of the needle array. You're now ready to begin treating patients with the Stivax system.